Well, welcome to our conference. This is the second annual Social Justice Conference where we focus on issues that we think are very germane to our Central Valley. And as often as we can, we bring in individuals who are leading efforts to address these problems in very concrete ways, often working for nonprofits or for community organizations that are here to advocate for underrepresented populations and address issues of disparity and inequity. And it's one thing to think about the theoretical side of these problems. It's another thing to think about what's going on where the problems are lived and where people are trying to commit their energy and focus and attention to helping to solve these problems or at least mitigate them. Our first speaker, who's kicking off our conference, spoke with us last year as well, and I was really interested in the perspective that she and her organization are bringing to the healthcare needs of our region for a population that is often marginalized from access that others take for granted and are quite comfortable with. But the discomforts are really real components of these people's lives, and to address them, I think, is a critical contribution to a community that is struggling as much as ours does to balance equities that the society offers select populations. Karissa Moreno is a bilingual native of the North Bay area. She's a lifelong advocate of minority advancement. She earned her BA in Cultural Anthropology from UC Santa Barbara, a master's degree from the University of Chicago. After spending years working with at-risk youth and as an educator, she found her passion fighting to eliminate health disparities and to improve access to care. She worked at Santa Rosa Community Health Centers for over 7 years, and then in the spring of 2015, she joined Livingston Community Health as their Chief Operations Officer. She's here to speak about a topic very dear to her life, to her work, and it's a topic that I hope not too many people in the room are as intimately familiar with as the people who need the help. But Karissa, come talk to us on the right to thrive.
Can you guys hear me okay?
Absolutely.
Okay, how are you doing?
Great.
You excited about this conference?
Yes.
Yes, you're gonna learn amazing things?
Yes.
Okay, good. Okay, I'm gonna force you into enthusiasm because that's what we need to do today. So I'm gonna tell you a little bit about what we're gonna talk about. So first, achieving health. It's all up to us, right? We are in control of our health and wellness, or are we? We're gonna look at that. We're gonna look at the systemic effects of poverty. I'm gonna challenge our moral lens on what poverty looks like. A view into a valley, so focusing in on the area that we live. Looking at community clinics as a model to challenge the traditional mode of healthcare. And then finally, I'm going to present to you accountable communities. So looking at health and social justice and some of the things that we can do. So achieving health, it's all up to me, right? So how are you guys feeling today? Feeling good? It's
Great.
Yeah, good. All right, I need an audience that calls back like, yeah, I'm feeling good.
Feeling good.
Feeling good. All right, thank you. Got my cheerleader up front. So we're feeling happy, enthusiastic, engaged, and motivated, and supported. Support's always important, right? We need our social network. So what does health look like? What does this look like for us? Is there one particular image of health? Is there one model of that? No, we might have an idea of what health looks like, but there's not a particular model. So there's no, oh good, thank you, we can see Bella a little better. So there's no perfect or ideal model of health, right? And we always dream of like, I wish I could change this, or I wish I could change that. But that doesn't really talk about health, right? And I'm not talking about your normal ups and downs, because sometimes we feel good, sometimes we feel a little worse, but just in general, how is it that we're feeling? So general well-being, our general health and wellness, how do we achieve that? How do we come to this place where you say, I feel okay, I feel good in my health, I feel good in my being? What does that look like? And how do we achieve it? How do we achieve health? Because when we think about it, health is kind of an ambiguous topic. It can mean a lot of things to a lot of different people. And it's not something that we generally talk about when we're talking about social justice, which is one of the reasons why I'm here, because I want you to incorporate this in your thought process when we're talking about advocacy, when we're talking about efficacy, when we're talking about having social justice in the Central Valley. So we know that there's things that we can do to be healthy. So we want to eat right. We're told, the proper nutrition, and we try and do this most of the time. We want to exercise or, at least make a good attempt at it. And we want to get a good night's rest, especially when you're in school and you're studying, accepting exams. We're, getting close to exam periods here, halfway through the semester. And we want to go to our regular checkups, right? These are the things that we have control of for our health and wellness. So it's all in your hands. You can do this. Or is it? Is it really up to you? So this is what we're going to look at a little bit. So consider the place that you live. The place that you live can actually affect your lifespan. Have you ever considered that? How could that possibly be? How could where you live affect your lifespan? How could it add or subtract years to your life? Well, it does. So let's take an example. Marin, California. Anybody know where that is? Just north of San Francisco, across the Golden Gate Bridge. Very expensive place to live. I was actually born in San Francisco and lived in a tiny little hippie town in Marin, California, back in the day when it was affordable. And then I moved to Sonoma County. So somebody that lives in Marin, California can live 15 years longer than somebody that lives just 8 miles away. 8 miles away. How long does it take to drive 8 miles? No more than 15 minutes, right? So wouldn't you say like, if I can add 15 years to my life, I'm going to go to Marin. I'm going to live there, right? Forget about that other town. I'm going to live in Marin County. But why can't we all live in Marin County? Because it's prohibitively expensive. Anybody know what the rent of a 2-bedroom, 2-bath house looks like in Marin County? Yeah, $5,500 a month. $5,500. Okay, how many of us make that much a month? How could you pay for anything else? You're looking at putting 15 people in that house to be able to make your rent, right? So it's not always attainable, right? You can say that these areas are more prosperous, they have better health conditions, but it's not attainable for all of us to live there. So how can this be? How is it that the place that you live affects your health? And why is this? Well, this is where we're going to look at the systemic effects of poverty. So again, what is health? So let's look at the definition here. So this is from the preamble of the Constitution of the World Health Organization, and it's been unaltered since 1946. So health is a state of complete physical, mental, and social well-being. It's not just the absence of disease. So it's not just about, feeling okay, right? It's about mental and social well-being as well. And it's a fundamental human right. So again, this is from the preamble of the World Health Organization. And this was created years ago. An essential human right, and it's about whole person wellness. And again, when we think about health, we just think about not being sick, being okay, feeling all right, not having disease. But it's not just about that. It's about whole person wellness. Health equity is the attainment of the highest level of health for all people. And equity doesn't mean equal, right? It means what you need to access the care that will help you be on the same level as everyone else. So equity doesn't equate to equal. It's important as we're kind of getting into this deeper. Health is also about empowerment and self-efficacy. So somebody that is healthy, again, isn't just the absence of feeling sick. It's somebody that can be engaged and empower and have a voice. So good health is more than just ensure basic well-being. It allows for self-efficacy and participation in society at large. So we're talking civic, political, social, and economic. It's about being able to work. It's about being able to study. It's about being able to be engaged in the community and having a voice. So again, I want to challenge the way we traditionally think about health. Don't just think about health in the box of, I feel good today. I feel healthy. I'm taking my vitamin C and I am not going to get sick because I got my flu vaccine. No, it's more than that. So we're going to look at the issue. We're going to look at the systemic effects of poverty. But first, I want to challenge this moral lens that we wear. So when you're walking in the street, and if you walk downtown Interlock, go there on a Sunday afternoon, you're going to see this. And what is it that we do when we see somebody that's homeless? What is it? What do you see? What is it that you think when you see somebody in the street? And what is it that you feel? Well, a lot of times we don't see, we don't think, and we don't feel anything because we are conditioned to turn away. We are conditioned to ignore this problem. We are conditioned to think, that doesn't involve me. It's that person's fault, and I don't need to take responsibility for this, right? Because we have this moral lens. We think, if you're poor, well, that's your fault. You did something to deserve this. You didn't try hard enough. You didn't study hard enough. You didn't advocate for yourself and go and work and take care of yourself and make sure that you're all right. Because this is a dog-eat-dog world. This is an us versus them. But it shouldn't be that way. It shouldn't be that way. And we have to look that there are conditions greater than the power of one individual that affect our ability to succeed in this world. And we think, oh, we're all in this room. We are here at this conference for social justice in the Central Valley. We're all in a position where we're thriving because we're here right now. And that means that often we think, well, if I did okay, if I was able to get to this place, then why didn't that person? What's wrong with them? If I were able to overcome barriers and I was able to overcome obstacles, well, shouldn't everybody else? Didn't I work hard to get to this place? And why didn't they? So we often use ourselves as a comparison, and we use ourselves as a place of judgment. And this is really what I want to challenge. I want to challenge this moral lens. So again, it's not that, oh, it's that person's problem. They're in the street because they did something to deserve it. They didn't work hard enough, and they didn't fight hard enough. So let's walk this back a few steps. I like cats, so I always have to use cats in my PowerPoints. So let's consider the American dream. The story that we have been told since the time we were little children, that the American dream is the pursuit of happiness, life, liberty, right? So let's look at the 1950s ideal, back in this day, America's heyday, when everyone was happy. We had our nuclear family, a white picket fence, a house, a car. You know, everyone knew where their place was and what you could do in life. And part of this dream is that every child could grow up to be what he or she wanted to be, right? This is the American dream that we are told. You just work hard enough, you study, you're going to be whatever you want to be, right? Well, what if we fail? What if we don't attain this? What if when I was 6 years old, I said, I want to be a veterinarian, but then I didn't become a veterinarian, so that's my fault, right? I failed at that. So I'm not buying this American dream, right? So I am not buying this. I'm not loving it. And I want to look a little deeper. So what are the myths that we are told? What are the stories that we are told that are absolutely untrue? Is there really an equal opportunity for every child? How many people believe that? Every single person that is born in this country has absolutely same opportunity to achieve whatever they want. Good. Nobody raised their hand. Bravo. Good job, you guys. So what if it's not all up to us, right? What if we don't have control over the outcomes of our lives? So let's walk it back to health again. So part of the World Health Organization, they had an Ottawa Charter for Health Promotion in 1986, and they decided that there are 8 prerequisites for health. And again, challenging this view that it's just the absence of being sick. So peace is one, shelter, education, food, income, a stable ecosystem, and this is going to have significant value for the Central Valley, a stable ecosystem, sustainable resources, equity, and social justice. So these are the requisites to be healthy, to thrive, to prosper as a human being. Because again, remember, health is a fundamental human right. But there are social determinants of health. How many people have heard this? Social determinants of health. Okay, so this is going to be a new concept for some of you. So social determinants of health are conditions in which people are born, live, learn, work, play, worship, and age. And that affects a whole range of health, functioning, and quality of life outcomes and risks. So this is from the Institute of Medicine, Disparities, and Care. This is influenced by conditions, so social, economic, and physical, and settings, so school, workplace, and neighborhood. And the availability of resources has a huge impact on health, the availability of resources. So what would those resources be? What can you think of are the resources? So we're looking at food, housing, transportation, education, access to healthcare. That determines the length and quality of life. So really, access to these resources. And again, this is part of building the foundation here for our understanding of why it's not all equal, why we're not on the same playing ground. So let's walk this through. So economic stability, these are the social determinants of health. So that would be employment, income, expenses, debt, medical bills, and support. A neighborhood and physical environment, so again, going back to the place where you live can determine how long you live. So housing, transportation, safety, parks, playgrounds, and walkability. And again, these are things that an individual cannot control. I can't just, put a bus in my neighborhood so that I can get to work. It was funny. So I come from Sonoma County, and Sonoma County is very resource rich. So that means there's, good infrastructure, there's a lot of services, and there's a big safety net. So there's a big safety net for those that are at need. When I first came to Stanislaus County, and I went to Livingston, which is in Merced County, I noticed that there was a bus. You know what the name of that bus is? The Bus. It is called The Bus because there's one bus. Yeah, that's affects things. Okay, so education, so literacy, language, early child education, vocational training, and higher education. Food, so hunger, access to healthy options, which we're going to look at a little deeper. Community and social context, so social integration, support system, community engagement, and discrimination. And then the healthcare system, so health coverage, provider availability, provider linguistic and cultural competency, and quality of care. So these all influence health outcomes. So this is what we're talking about when we're talking about the social determinants of health. So if you look here to this graph, you can see, I have a little clicker, that the physical environment, the socioeconomic factors are more than half. So again, challenging this view that we are totally in control of our health outcomes. Here you've got genetics, so, oops, pardon me, let me take it back. Here you've got genetics, so this is blaming it on mom and dad. Your medical care, so that's access, if you can even get in to see a provider. And then you've got this 20% of health behaviors. And we're going to look at the health behaviors a little bit because then we can say, oh, there might be some socioeconomic things that influence health, but really this 20%, that's that person's fault, right? So if you see somebody in the street, oh, well, maybe this person has substance use issues. And maybe that's the reason why they're in the street. But again, I'm going to challenge that concept. So we're talking about a safety net here. So social determinants of health create health inequities. So unequal distribution of health damaging experience is not in any sense a natural phenomenon, but is a result of the toxic combination of poor social policies and programs, unfair economic arrangements, and bad politics. So that sounds like it's bigger than you and me. That sounds like it goes outside of the individual. So these are the social, economic, and environmental conditions that create health inequities. And health inequities are avoidable, and they are unjust. Okay, so it's not fair. It is absolutely not fair. So again, let's take a closer look. And I just learned how to use these things, and I got really excited because I give all the trainings at my work, so I'm like, yes. So we're all in school here. We're all college pursuers or graduates. So you know that if you graduate college, your earning potential doubles than somebody that just completes with a high school diploma. Doubles. That's awesome, right? Well, what if you don't get a college degree? And what if you did not graduate high school? Because say somebody at home got sick, you had to take care of them, or there are other issues. So then, if you didn't graduate high school, your income potential is much less, right? And that's gonna influence where you can live, because you can't go to Marin County and pay $5,500 a month for your lovely 2-bedroom, 2-bath house, right? You're gonna have to live in a different situation. And the living condition affects the environment that you're living in, right? So you might be exposed to more environmental toxins, you might live right next to a freeway, you might not live right next to a train. So I live here in Turlock, and I go walking all the time. And one of the places that I walk is I walk down Main Street and then Broadway, and there was this tiny little house for sale. I'm renting right now. And the house is very charming and very cute and well priced, but it is right next to the train. That train goes by that house multiple times a night. So just think about sleep. Just think about a train going by your house at 55 miles an hour, because the trains go by very quickly here, blowing their horns. You can't sleep through that. There's no way you can sleep through that. So what does that do to you if you're woken up 5 times a night? Do you think you're gonna feel good the next day at work? And what if that happens night over night over night? And that's just one example. So environment can also affect access. Who here has heard of a food desert? Awesome. So food desert. So we live in the breadbasket of California, breadbasket of the United States. We grow all our produce here. But they're huge food deserts. So what that means is if I live in Livingston, California, there's not a Safeway there. If I live in Livingston, California, and I have to walk because I don't have a car, and I can't walk very fast because I'm diabetic, I have to go down to the corner store. And that corner store has some produce, but let me tell you, it's pretty crappy produce. It is not what you would find in Whole Foods. It is not what you would find in Safeway. You're talking organic or fresh? No. So I might not buy some of that produce, and I might get some tortillas instead. And I might make some food and just fill up on other things, right? But I'm not filling up on unhealthy produce. So when we walk it back again to that place of, oh, I'm gonna eat right, and I'm gonna exercise. Well, if I'm living in Livingston, California, I don't have transportation, I can't walk very far, I'm relying on that corner store. And you know what? That corner store is gonna cost me way more than it would if I bought food at Safeway. You know why? Because Safeway's big. They get a discount price on all their stuff because they have markets all over the place. You think that little corner mom and pop shop is gonna be able to get the same pricing as Safeway? No, right? So all of these conditions account to and create stress, right? So if I'm living poor and I'm woken up every night, I don't have access to good produce and food, you know, I could be a single mom, I could have all these issues and health issues, that creates stress. And then stress equates to risky health behaviors. So again, going back to that 20%, take off your moral lens. And I challenge you, do not judge people based on your own experiences. Do not judge, right? Because if you're living within those conditions, there are behavioral patterns that are assumed as coping mechanisms. Because if I don't have a support network, if I don't have any other way to relax or de-stress, I'm gonna go for the easy things, right? And if my neighborhood corner store is pushing the legal drugs, then sign me up, it's gonna make me feel better. So cycle of poverty, this is just one view. So say I live in this systemic net of poverty. I have more exposure to trauma. I have more behavioral problems, discipline problems, because maybe I'm gonna act out against the confines in which I'm living, lower educational attainment, higher incarceration rates, and more single parent households. And the cycle repeats. So let's look at it from the infant standpoint. So an infant is gonna lack nutrition. And so that means delays in growth and development. So right from the start, if I am born poor, my nutritional access is less. So that malnutrition means that children can't concentrate and succeed in school, even if they go. So poor children have higher absentee rates. They have higher absentee rates. So that means that they're gonna have less education, they're gonna have more chronic disease, and it means that they're gonna have lower paying jobs or the inability to work. And then the cycle repeats. So poverty is systemic and it's self-propagating. So again, if you're born poor, it is more difficult to eke your way out of that. You have less access to resources, you have less help getting to the places that you need to be able to attain the education and the tools to improve your life. If you're born wealthy, you have an easier time at it. And poverty multiplies your problems, right? Poverty multiplies your problems. How many people here have ever felt stressed because of finances? Yeah. And have you ever been at a point where you don't know what you're gonna do to make it? Have you ever been like, I don't know how I'm gonna pay my rent or what I'm going to do? I've been there. It's incredibly stressful. And where you can't function at the highest level in other areas of your life because you are so scared that you're gonna be on the street. And this creates inequities. And that's what we're talking about today. That again, we are not all on the same playing field. There is definitely inequities out there, and I'm not just talking about health inequities. And poverty is nearly inescapable. When you're in that system, it is deeply difficult to get out. So is this their fault? Again, is this their fault? Is this the fault of the individual that is trapped in this system? No. No. So take off that moral lens. And it affects us all. Poverty is very expensive. So 46 million Americans currently live below the poverty line. That's a lot. So we're gonna look a little bit about the high cost of poverty. So this is by Barbara Ehrenreich. This was 2007, she wrote The High Cost of Being Poor. And she was a journalist who decided that she was gonna go on this social endeavor to see if I can make it on minimum wage. And she was like, I'm a college educated woman, I'm a journalist, I'm gonna totally go this, I'm gonna rock it, and I'm gonna be fine. I'm gonna have all these little tips and tricks and I'm gonna be successful. And one of the things that she feared when she first started out on this endeavor is that she was scared she would be revealed as a college-educated woman. So she thought when she was going to take these low-income wage jobs, she first tried to be a waitress, that, they were gonna out her as an educated woman and say, you do not belong here. You are an educated woman, you do not belong here. Well, what she found is she couldn't cope. She did not thrive. She couldn't make it first as a waitress. She eventually made it cleaning in a hotel. But what she found is it's very, very difficult to make it when you're earning minimum wage. And you can't. You have to do more than that. So poor people are less likely to have bank accounts. Why would that be? Because you need a minimum amount of money to open a bank account. So they cash their paychecks at check cashing shops. And guess what? They charge $5 to $50 to do that. So right off the top, you've got less money. Those earning less than $30,000 per year are charged 2% more for a car loan. Why would that be? Why should you be penalized because you're making less? Guess what? Because you're making less, they think that you might default on your loan, that you might not be able to make that payment. So they're gonna take a little bit more up front. Is that fair? Hell no. And they pay $400 more average annually for insurance. $400 more for car insurance. Penalize me again because I'm poor. And why would that be? Think about the environment. Think about the neighborhood you live. I can't live in Marin, California, right? So I'm gonna live in San Rafael, and I'm gonna live in a neighborhood that has higher crime, and my car might get vandalized, so they're gonna charge me more for my insurance. Penalized because I am poor. Poor people don't have funds to furnish their homes, so they tend to buy through rent-to-own businesses. And guess what? That costs more money. So one study showed that a $200 TV cost $700 in this way. Again, penalized because I am poor. Is this fair? No. Poor people tend to live in areas with poorer resources. It means less access to quality food and groceries, and less access to health services, including dental. So again, if I have to go to my corner store that has poor produce that is more expensive, then I'm going to be eating less nutritious food. I'm going to have the tendency to get sick, but then I might not have access to health care. So again, penalized because I'm poor. So this is traumatic. It's pretty traumatic to live in the systemic cycle of poverty. Traumatic events are extraordinary, not because they occur rarely, but rather because they overwhelm the ordinary human adaptations to life. They overwhelm you. So in effect, you become less effective as a self-advocate. You become less effective in your ability to attain what you need because you're overwhelmed by that stress. And if we look at what this does to children, survivals of childhood trauma are up to 5,000% more likely to attempt suicide, have eating disorders, or become IV drug users. So again, that person that you see on the street, you think, oh, it's their fault, substance issues, 5,000% more likely. I just want you to feel the weight of that. That's absurd. Does this make you a little upset? Yeah. So obviously this affects health outcomes. So if you look over here, so those that are earning $15,000 or less, this is the level of health issues. So health issues go up as you earn less, and they decrease as you earn more. That's huge, right? So we're looking at those that are earning $50,000 or more, relatively well on health, 3.7% of health issues. Those that are earning $15,000 or more, 20% of health issues. That's a big difference. So, question of the day. Which racial groups suffer more health disparities? Ding, ding, ding. These kids know. So if we look at it, the national average, so this was in 2013 by race and or percentage of children in poverty. National average is 22%, right? So about 1 in 5. But African Americans, American Indians, and Latinos suffer disproportionately more than other races. And excess medical expenditures due to health inequities are huge. So premature deaths in the United States because of avoidable health disparities. You know how much our government spends on that? How much do you think? Anybody have a guess? Anybody have a guesstimate? So in 1 year, premature deaths due to health disparities, how much? 200 billion. 200 billion. Yep. What could we use that money for? Just think about it. So this is unjust. This is not fair, right? So again, what do you think now? What do you think now? One of the biggest reasons for bankruptcy in the United States is because of medical bills, because of these high costs of care that we can't afford. So let's look at the Central Valley. So again, place can determine health. And California, the land of Hollywood and dreams, yeah, we have the highest poverty rate in the nation. So 1 in 5 live in poverty in California. We used to think of the Deep South as the poor place of the United States, the poor place in the United States. But if you look at this, and this is adjusted for housing costs from 2013, Mississippi is doing a little bit better than California, right? So we have to think of ourselves as the land of poverty, right? Just not the land of Hollywood and dreams. This is the land of poverty. So what about the Central Valley? What about closer to home? So poverty rates in California, if you look over here at San Joaquin Valley, Los Angeles beats us, so we're doing better than Los Angeles. That's good. But San Joaquin Valley, we're pretty high. And if you look at Stan County, again, let's go back. When we look at Stan County, we're about 23%. This is for 2012. So more than half of the population in Merced and Stanislaus counties live 200% below the poverty level, more than half. So Merced County just recently came out with the 2016 Community Health Assessment. So I wanted to take a look at just one county and how they're doing with their health and wellness. So we know that Latinos are the largest group in Merced County. So we're pretty diverse. And a majority of our residents and 2 out of 3 children live in poverty. 2 out of 3 children live in poverty in Merced County. So the population of 25 and older with no high school diploma, if you look at Merced, it's much higher than it is in California or the US. It's much higher. And again, Latinos are disproportionately affected by this. So when we talk about race inequality, you're looking at the inequities here. Homelessness. So in California, you can see, so we're looking at the grade levels. Merced County is doing better for pre-K and grades 6 to 8, but if you look at high schoolers, there's a much higher level of homelessness in high school age groups. So maybe that's because people dropped out of school, because they left home, but there's a much higher rate of homelessness for high schoolers. And then homeless subpopulations, you can see that it breaks down. So if we look at victims of domestic violence, physical disabilities, and chronic health conditions, we can see that our environmental factors are really influencing our ability to thrive. And this equates to our ability to be able to afford housing. Access to care. So me being in the health industry, health professional shortage area. So it's called a HPSA score. So a HPSA score means how many providers are there per the number of people that would need to access them. All of the residents of Merced County are at 100%. So that means that we do not have an equal ratio of providers to meet the number of people that have a demand for them. And it's much higher. It's much higher than in California or the United States in general. So it's a huge disparity in Merced County. So again, it's the number of providers that are able to meet the demand. And we just don't have providers here. So let's look a little bit about the diseases in Merced County. So cardiovascular disease is the #1 killer. And it's not just heart disease, it's also related to diabetes. So these things are very deeply connected. And again, you can see that minorities are much more affected by this. Cancer is the second leading cause of death. And if you look at the trends in the US, US is doing a little bit better, California is doing a little bit better, but Merced is pretty much the same. So we're not improving, although the trend in the rest of the nation is improving. So we are still dying of cancer faster. Why would that be? Why would we have more cancer? Why are we pretty much the same as far as death from cancer? Again, think about the environment that you live in. Think about the environmental toxins that we're exposed to. This is my favorite, injury and violence. This is the third leading cause of death in Merced County. Injury and violence. I've been all over the place. I went to school at University of Chicago, and I lived in a pretty high crime area. And I was like, yeah, I've been all over the place. I know how to live in, someplace that has high crime. And when people told me there was high crime in Merced, I'm like, what? These tiny little agricultural towns? Are you kidding me? But yeah, there's a lot of crime. So if you look here, motor vehicle accidents. So the 99. Anybody ever scared to drive on the 99? Yeah, I am. I don't like my commute very much. But then you also have poisoning and overdose. So poisoning could come from, again, agricultural exposure to pesticides, environmental conditions, and then overdose. So think opioids. Next is violent crime. So again, look at the crime rate in the United States and California. They're decreasing. So crime in the United States overall is decreasing when we're staying pretty much about the same. So our crime rate's not going down at the same level. So we're not trending with the rest of the states. And then robbery and aggravated assault. So violent crimes are the #1 crimes in Merced County. And this is usually the result of poverty. So respiratory disease. Don't we have great air quality here in the Central Valley? You just want to take a deep breath on a summer day and you just smell the rich air of agricultural town, right? Because we're in a valley, so that air just settles. And in the summer, there are a lot of pollutants and particles in the air. So again, you have chronic respiratory lung disease where we are higher in Merced County. We're doing a little bit better with pneumonia and influenza, but we're definitely high with respiratory disease. And then asthma, we have more children in the San Joaquin Valley that suffer from asthma than any place else in the country. Right here, folks. Breathe deep because it's good, clean air. So diabetes. Diabetes is something that us in the healthcare industry, we're definitely focused on. So Merced County has a higher diabetes age-adjusted mortality rates in both the state and the nation. And this discrepancy has grown over time. So again, Merced County is going against the positive trends that are happening in the United States. And we also have higher prevalence of pre-diabetes. So what pre-diabetes means is that you are higher likely to get diabetes. And that means that our conditions can worsen over time. And just so you know, you can't just have a touch of diabetes. And look at this. No, once you're diabetic, you have to control that for life. So again, place can determine health. In the Central Valley, when we were looking at Marin, 15 years difference. Well, depending on where you live in the Central Valley, add or subtract 21 years off your life. 21 years off your life. I'm thinking about taking a ticket back to Marin County because then I can add 15 years to my life. But no, in this area, 21 years, just by where you live. So again, challenging that moral lens. It's not just up to the individual. There are other effects, or there are other influences that affect our health outcomes. So this is all pretty grim, right? Not feeling very good about the air we breathe or opportunities, and how do we put a positive spin on this and think about what can we do to change it? Well, I'm going to talk about community clinics and what we do. So first, we're going to talk about a traditional care model. So in community clinics, we challenge the way things have always been done, right? We really want to get away from that. So in the traditional model of healthcare, the provider is the benevolent and magical healer of all ailments. I have an RX pad, and I'm able to do away with any of your diseases because I have the cure, right? Providers have the magic wand. Well, in this model, patient doesn't have much control. They just have to sit there and be like, okay, doctor, you want me to take that? Okay, I'm good. And there's often a disconnect from what the provider is recommending and what the patient understands. Because think about it. How often is that patient with the provider? 10 minutes, maybe 15 minutes, more likely 5 minutes, right? So it's not a lot of time to influence these health outcomes. So in the traditional model, patient gets sick, goes to the ED quick, provider writes script, and then the patient's better. All better, all fixed, or not. So does this model lessen health inequities? Does it empower patients? No, it doesn't do away with that. So community clinics, we try and change the model of care delivery. So Livingston Community Health, it serves both Stanislaus and Merced counties. And we take all patients, right? So it doesn't matter what their coverage is. We will take every patient that walks through the door, no matter what. And we serve a population that has great health disparities. So we are really the safety net for the people that we're talking about. We served about 15,000 patients in 2015, and because we've grown in 2016, we've served about 17,000 last year. And we serve a very diverse patient population. So one of the ways that we're different is we really focus on delivering care for the patient's needs. And so that's talking about appropriate language, health literacy, and cultural competency. But we're also talking about whole person health and wellness. So it's not just the medical conditions, but the social, environmental conditions that we're treating as well. So we have substance use programs, we have behavioral health, we have team programs, we have OB programs. So we're looking at 360 care, whole person wellness. And it's really about empowering the patient. So if a patient is empowered to be the agent of his or her own wellness, this can transcend other areas of her life. She can suddenly see herself differently, feel empowered as a human being, deserving a life free of trauma. So we're trying to change the model, but that's not really enough. We need to do more. So we need to be more innovative, collaborative, and action-oriented. And we need to extend our reach to eradicate these inequities. We needed to look at the root of the problem and not just the symptom of the disease. So what about 2017 and beyond? So in light of the recent election, I'm not going to talk politics with you, but just thinking about Obamacare, thinking about some of the recent threats to, change this. Are we a little afraid? Yeah, maybe just a little bit. So this is where I'm talking about accountable communities. So extending beyond healthcare, what is it that we can do? So let's first review health. So again, it's a state of complete physical, mental, and social well-being, not just the absence of disease. And again, it's a fundamental human right. And equity is the attainment of the highest level of health for all people. And this is about self-efficacy, right? Somebody's ability to engage in society at large. So health and social justice. Social injustice is killing people on a grand scale. And one of the reasons why is because we have a moral view of poverty. We are not looking at the systemic effects of poverty and why people are kept down and how poverty affects health outcomes. And so again, we have to challenge how it is that we're looking at this. And we need change, right? We need change. So I want to share this quote with you because I think this is really important. So this comes from George Benjamin. He's executive director of the American Public Health Association. He presented this in 2015. And he says, today, the biggest threats to the health and longevity of Americans are preventable diseases. So we're talking heart disease, diabetes, the things that we reviewed in Merced County. These are the diseases that are burying us in preventable suffering, as well as crippling our communities with mountains of avoiding medical bills. So remember what I talked about preventable deaths. 200 billion that we spend on premature preventable deaths. The root causes of many of these health threats are inextricably linked to the social determinants of health and the conditions that shape a person's opportunity to obtain good health and adopt healthy behaviors. So again, don't judge somebody for the behaviors that are a result of the system in which they live. These social determinants include access to safe housing, good jobs with living wages, quality education, affordable healthcare, nutritious foods, and safe places to be physically active. They also include racism, discrimination, and bias. So civil society is invested with the right to secure mutual protection and welfare, where we all contribute to the greater good. So this is a social contract. And I think we've forgotten about that. We buy into the social contract so that we are all taken care of. So it's a sense of accountability, it's a sense of responsibility, and a sense of ownership for how it is that our neighbors are doing. So when we look at somebody in the street, when we look at somebody that's not doing well, we should feel a sense of responsibility for that. But we've forgotten about this. We have forgotten about the responsibility to our society at large. And health is about social justice. And so I really want to encourage you to include that in the discourse of what social justice is. Because as we saw, if somebody is not healthy, then they don't have self-efficacy and they cannot thrive. Health is not a privilege, it is a fundamental human right that we must fight to preserve. And it starts with you. It is in you, with you, and from you. So we need to take responsibility. So imagine a space where we all have ownership in this. Imagine a space where we can do something. Well, what would that look like? We can help reduce inequities in the Central Valley. So what are the things that we can do? So here, let me take it back to this picture. So imagine somebody, I'm going to call her Maria. So imagine Maria isn't feeling so well. So Maria has her sister and she says, hey, there's Livingston Community Health. Why don't you go and see a provider? So she goes, she makes an appointment, she's a provider. She finds out that she's pre-diabetic. So her provider tells her, oh, you know what? There is this new class in Livingston called La Vida Dulce. You will learn about prevention for diabetes. And this is informed by the United States Health Task for Diabetes Prevention. So it is evidence-based research on how to help somebody engage in their health and wellness. So she goes to that class. And then she also finds out that at Livingston High School, they are now teaching Zumba twice a week for free, so she can start exercising. But she's feeling a little down and, oh gosh, I'm starting this new diet and I'm exercising. So she decides that she's gonna go see a social worker. And that social worker is gonna talk to her in Spanish, gonna help her out, gonna give her some more tools to help her feel better about herself. Well, they've also improved the lighting, so she can walk freely in her neighborhood, she doesn't feel scared, and she can talk to her 13-year-old daughters as they're walking in the neighborhood. And because Maria is doing a lot better, then her daughter is doing a lot better. And it continues, right? So think about the things that you have. What are the tools and resources that you have? Say you've taken a nutritional class, say you're in a nursing program. You can give that back to the community. Say you have learned how to control your finances. You can give that back to your community. Think about the things that you can do. We have to weaponize our knowledge in a way that we can use it for the betterment of all. I think a lot of times we think we don't have the power within ourselves. This is an external issue. This is something the government needs to take care of. This is something the schools need to take care of or the hospitals need to take care of. But we really do have power to change things. We just have to look at what it is that I have in my toolbox that I can give back. To give an example, when I worked in Santa Rosa, I saw that there were a lot of women that were depressed. They didn't have a space of their own. They didn't have anything that they could do to make themselves feel good. So I started teaching Zumba. I did not have a Zumba certificate. I went on YouTube and I learned how to dance. So I was able to give these women something to do. And they felt better about themselves. And it was one little thing that helped me and it helped them. So we can all do something. So again, we can reduce the health inequities in the Central Valley. Not a whole lot, but a little bit. And we can contribute. We can do things. Again, you just have to look at what your toolbox is. And you have to take off that lens of judgment. We can contribute to a healthy community, but only if we take a sense of ownership for this. Only if we feel that we can contribute. And you've got this. You can do it. So thank you very much.